Hi again. We are going to discuss about an interesting concept, a new concept of minimally invasive facelifting techniques or non-invasive scarless facelift. When we are talking about the facial aging, we are losing the sharpness of the brow area, the sharpness of the cheekbones, sharpness of the chin. The reason why we are losing that sharpness is because we are losing bone, particularly in this area. So this is getting melted. This area is getting melted. This area is getting melted. The corner of the mandible is getting melted, and we are losing all this area. But when I transfer the patient's own fat or stem cells into these areas, what will happen? This will be filled and the eyelids will be lifted, the midface will be lifted, and the chin and the jawline will look much sharper. If the patient is really having like a thin skin, too much sagging, there's nothing to do but do the incisional mini facelift or neck lift. But there's a huge group of patients who are between the ages of 35 to 50, where the skin sagging is not too much and the skin quality is good. In those patients, there is another way, which is a cutting-edge treatment. We call it microlifting. Basically, it's a closed facelift, or it's an incisionless facelift. In those patients, after putting the volume back, using patient's own tissue, we can just enter from the lateral side of the cheek, going in and doing a closed mid facelift, which literally takes 15 minutes on each side. Where, for example, we enter from just behind the ear, go inside, and lift the skin up just from one single small hole. Basically, we are talking about a facelift, but in a closed fashion. They are totally different than thread lifts. In the thread lift, you are using barbed sutures. You just put them in and then wait the skin to be lifted. Usually they last around 3 to 4 months, whereas a microlifting procedure is taking you back in time 5 to 7 years, and then the aging process continues from there. This procedure is done under sedation, so no general anesthesia is needed. It takes around half an hour to fulfill. The patients stay at the hospital just 2-3 hours and they can later go home, and in 4 to 5 days they will be back to their normal social environment as well as their working habits. It's a very nice cutting-edge procedure, of course only for the patients who are on the right position with good skin elasticity and good skin quality.